Hi, everyone, and welcome to the 5th episode of the PrincipalED podcast. I'm your host, Grace McCallum, and I am thrilled to be here today with our incredible guest, Dr. Kaajal Abrol. Kaajal, thank you for being on today. You are all going to love this episode. She is a superwoman. She is a double board certified fertility physician. And as a reproductive endocrinology and infertility specialist, she actively connects with both the medical community and the public by speaking on a range of fertility topics. She has said it is truly a privilege to help people build and grow their families, and that she values the job she has in educating patients, specifically women, on their fertility and reproductive health so that they can make informed choices both now and in the future. She also shares her expertise through social media, and you can find her, and I'm going to spell it for you for those who are listening, KaajalAbrolMD on Instagram. And she's the host of her very own podcast, The Fertility Talk Doc. Most recently, she delivered a TEDx talk on fertility age and the importance of education around reproductive health. In addition to being a physician and everything I've just said, Dr. Abrol is also a wife and mom of a daughter, and I'm very happy to say that she's a member of our wonderful community here at Branksome Hall. Welcome to the podcast, Dr. Abrol. We are so happy that you're here. Thank you for being here. I know you're so busy.
Thank you for having me. I'm really excited to chat today.
I was so thrilled. And you're the first of our parent community to be on the podcast, so it's kind of a special moment. And you're the first one to test out our new mics.
Amazing.
We've been, since the podcast started, we've been testing out all of these different cameras and mics, and we were in my office, and now we're here in the junior school library. And in just a few months, we'll be in our podcasting studio in the new ICAS building.
So
you'll have to come back and see it and give us some tips on setting up our podcast space. You've got lots of experience.
Yep, sounds good.
Well, I'm so excited to have our listeners hear all about the incredible work that you do and your story. I think your story is so unique and will really speak to our girls and students who are very interested in being a powerful woman in the medical field or in STEM. So let's start from the beginning. Dr. Abrol, tell us about growing up. Were there any powerful women that really helped shape you or inspired your journey to where you've come? It's been pretty incredible.
So I was born and raised in the GTA, but both of my parents immigrated here from India. And in fact, my mom was an elementary school teacher when I was growing up. So grade 3, 4 is what I mostly remember her teaching until several years in. She had a bit of an entrepreneurial spirit, and she convinced my dad to start a business. And so they started a printing company, which they ran together for many years until, despite my dad passing away, my mom kept growing and building that business. So I would say that she was and is the most influential person in my life. My mom really taught me the importance of dedication and hard work, but also really the value of believing in yourself.
Yeah.
And kindness. I would say she was the most caring and kind person I've ever known. And I carry that with me a lot now.
Wow.
Mm-hmm.
How old was your dad when he passed? How old were you?
He was 60.
Oh, wow.
I was 20.
That's young to lose your dad.
Yeah, and he was sick for, I would say, half my life. It teaches you a lot. And I didn't grow up in a family of physicians or a lot of exposure to medicine. But what I was exposed to are some really amazing doctors. And in fact, my dad's family physician is the one who really stirred this interest in medicine in me. And really, I wanted to have an impact on people's lives the way he had an impact on my family's life. So that sort of stirred my interest in medicine. And then I would say my mom is the one who kept it going. Like, she supported anything we wanted to do and really encouraged us to do it. And I did.
She sounds incredible. I taught grade 3 for a lot of years. So I was like, oh, wow, another grade 3 teacher. But how incredible that she was an entrepreneur. And it sounds like your dad was sick for a while during your childhood. So she really had to be a rock in your family. So she's an entrepreneur running this printing business. Your dad's not well all of the time. that's what an incredible mentor and example you have in her.
Absolutely. And still kind and patient. You know, all of it. She was the every woman. And I think that sticks with you, right? It really molds who you are.
It does. It really shapes who you are. And I was curious about what inspired you to be in medicine. And now we understand it was your dad's journey, but also the medical team that he had inspired you. What about them inspired you?
I think that there's selflessness, right? Like this, my dad was sick for quite some time. This doctor diagnosed him and then, sent him off to specialists. But he played such a vital role in my dad's journey throughout his illness and in my whole family's journey, like cared about us all the time. I just thought, wow, like one person can have such an impact on an entire family. I want to do that. I want to care for people. I want to make a difference in their lives. And then thankfully, I also like the sciences and the math. And so the whole idea of going into medicine seemed ideal.
I mean, it makes sense. And wanting to impact families, you're a fertility specialist. What a beautiful way for you to have an impact. It's such a high level of specialization. What made you choose this?
So I'd love to give you some mind-blowing answer. Kind of happenstance in a way. I went into medical school thinking I wanted to be a pediatrician. I loved kids. Of course I want to work with kids and I want to care for kids. Yeah. But then I did my obstetrics and gynecology clinical rotation in medical school. And I was like, wow, this is for me. I love everything about this. I love caring for women. I loved the variety. Like one day you could be in the office seeing women. The next day you're on labor and delivery. The next day you're in the operating room. I thought this is amazing. That kind of guided me to obstetrics and gynecology. And then in my first year of residency, I was exposed to the world of fertility. I had a mentor who was a fertility specialist, and I started doing a lot of reading at home. I think that's the first thing you got to want to learn about the subject matter. And I loved it. All these pathways, these hormones, they all just made sense. And then the more exposure I got to fertility care, again, you have a ton of variety and you are helping people build and grow their families. Like what better care and helping women in women's health. I just fell in love.
That's pretty incredible. I can see why you would. And knowing you, I could just imagine the impact that you must have on your patients. Infertility can be sensitive for so many women. And sometimes, even in our culture, it can be taboo. Can you tell us a little bit about how do you work to destigmatize this and empower patients throughout this really difficult journey at times?
I think the thing that I'm doing right now or for the last few years has really been increasing conversation around fertility and increasing education around it. So I've taken to a lot of different platforms and a lot of different ways that I want to get out there and talk about fertility and infertility. I started on Instagram and on social media because that's where patients are and that's where people are seeking out information. So I need to go there. Last year, I started a podcast. Season 1 is done. We've taken a bit of a hiatus. We're coming back with season 2 this year. And I thought it was a different way to get out more information. And really, I've been spending a lot of time doing public speaking in a lot of different ways because I think you want the medical community to be more informed about fertility, but also the public. There's so much people don't know. And the more we talk about it, the more people are going to feel supported. And the more people are going to talk about it, because I agree, it doesn't matter your cultural background. It is very difficult for people to find friends and community members to talk about still, and we need to change that. We just need to keep the conversation going.
That's great. I love that you're on social media and you've just done this TEDx. You're really doing a lot to bring people to the conversation in a way that's really accessible. I'm curious, there's so many advances in technology with fertility treatments and advancements in science. Is there anything that is on the horizon that you're really excited about because you feel like it's going to impact your patients?
That's a great question. The amazing thing about the field of fertility is that it's actually kind of young. And I can say just in the last 15 years, it has changed so much. It's rapidly changing. There's a lot of technology. It's changing all the time. I think lately what we've been seeing is the use of AI and AI tools in fertility care. So for example, watching embryo development and embryo selection and how can AI help with that, learning about egg quality and fertility potential of eggs. I'm really excited to see in the coming years really how AI is used more in fertility care, particularly in the IVF lab. I think there's so much more it can do. If I really forward think, something I'm really interested to see develop and have really great potential is stem cell research and innovation. I don't know where it will go, but I imagine a world where we can take stem cells and make eggs and sperm. I can't imagine what that means for women who have really low egg reserve or men who don't make any sperm and what it could mean for their dreams of building a family. So that maybe is a little bit further in the future, but I think the potential for AI changing fertility care is there right now and in the immediate future.
I think that's really interesting. How could AI help us with like identifying egg quality, for example?
I think people are using machine learning even now to learn about eggs and using databases and sort of comparing eggs in a database to say what is the potential for this egg to lead to a healthy embryo that has a best potential for pregnancy. We're already seeing that technology now. I think it's a little bit new and has a ways to go, but I think it tells us a lot because we're using egg freezing more and more now to help women preserve their fertility for later. So to use these tools to even better that technology and that treatment option would be amazing.
That's so exciting. And the stem cell research sounds really promising as well. But as you said, this is more in the future. What are you predicting? 10 years, 15 years?
I hope so. I mean, that would be amazing if in the next 10, 15 years we could see something like that develop.
You must have a lot of young women, and I know more and more it's becoming really popular for women to do things like freeze their eggs or do egg harvesting. As a younger woman than like when I was that age, that wasn't something I was thinking about. And it seems like that's what I'm seeing now on social media or with, just people that I know who are not as old as I am and are talking about this. What advice do you have for young women who are maybe seeing this on social media or who are beginning to think about their own fertility? What kind of advice might you have for them looking forward?
So the biggest piece of advice I have is understand your fertility. As women, we need to understand that fertility changes with age, especially as we leave our 20s and enter our 30s. I think knowing that is the first step, and I think being proactive about it is the second. So if you're a young woman in your mid to late 20s or early 30s and you don't see pregnancy on the horizon, maybe you're focused on your career or your education, maybe it's just not the right time for you, maybe you haven't found the partner and you want to do this with a partner, then I think you can still be proactive. You can see your primary care provider, maybe that's your family doctor or your nurse practitioner. You can ask to see a fertility specialist like me, and you can do some testing so that you can really learn about your fertility and decide, is egg freezing a good option? I think it is a great option that wasn't necessarily there for you and I when we were younger. It was really in its early stages of development. It's there now. We use it all the time. I'm very careful in my counseling. It's not a guarantee of a pregnancy, but it's certainly taking the pressure off of young women, and it is opening options for them to pursue pregnancy later in life.
How do young women access this? Do they go to their primary care provider first and then get referred, or do they go directly to a fertility specialist, or are both paths equal?
Most of the time you're going to your family doctor. I think having a conversation there is a good first step, but you simply request a referral to a fertility doctor. We're in the GTA. It's very accessible to see a fertility specialist here. So that would be the sort of right path. I think connecting with your primary care provider, your family doctor, is always a good option because it allows them to know what you're doing and what you're thinking. And, hopefully they're looking after you in the long term. But ultimately, you want to get to a fertility specialist.
Yeah, thank you. That's such good advice. And we have listeners actually from all over the globe, which is really exciting. And I guess, what would your advice be for them? It works differently than the GTA, and you don't know where they're listening from, but would it be that same pathway, first primary physician?
I think not knowing where they're coming from, that's always a good first step. And then they can guide you. But ultimately, you want to get to a fertility specialist to have the appropriate testing and counseling. I think doing testing alone is not enough. You need to know what those numbers and test results mean and what they mean for you at this point in time.
Knowledge is power.
Knowledge is power.
So many myths about so many things with women, but fertility is certainly one of them. Is there one myth about fertility that really gets you? One that you wish you could just dispel? And what would it be and why?
I think it would be, it's kind of two rolled into one, but I think it would be that age doesn't matter that much because fertility treatments like IVF can help. And IVF is amazing. So in vitro fertilization, where we can fertilize eggs with sperm in the lab, create embryos, and put them in a uterus, it's amazing. It gives us our best chance of pregnancy in most cases. But there becomes a time and an age where that egg quality is an issue, and IVF can't significantly improve your chances. And I really think that's important to know. Some people are like, of course that's true. Yes, we think of course, but there's many people out there that aren't aware of this. I see many women in their 40s and their mid-40s who think that IVF will help no matter what. And I think a big reason is because we have a lot of what we call like a little bit of a Hollywood effect or a celebrity effect, where you see a lot of women later in life, famous people, having babies. And the assumption is that, you know, they did fertility treatment like IVF and they conceived. So if they did it at 45 and 50, well, then of course you can do it too. People are using a variety of treatments. I'm not the physician to any of these people, but I think that we don't talk enough about other treatment options, like women who are in their mid to late 40s using, or in their early 40s sometimes, using an egg donor to help them conceive, because it's the quality of those eggs with age that really matters. So I really think understanding age is a factor, and understanding the limitations of fertility treatment like IVF is just very crucial. But also knowing that there are other options like donor eggs, should you need to consider it, that are available.
Now, is age, this is going to sound like a really silly question, but is age the same for everyone? For example, you know, one person's eggs at 40, are they the same? Is there like a magic number? Because we hear about, you know, genetics might play a factor, or different health factors or lifestyle factors can play a factor in your fertility and your age. Is there a magic number, or is it really about getting tested and understanding your own egg health?
I love this question. So I think that there are general age groups or age categories that are important, and I think other factors matter. So we know egg quality and quantity declines after 35, and more so after.
For everyone.
For everyone. It's starting to decline more quickly after 35 for everyone, more so after 37. So it's a big issue after 40. That being said, I see women at these ages with different egg numbers. The factor that we can't test as easily but is probably more significant is the quality factor. And that is a big issue for everyone leading up to and into their 40s. Everyone's going to have a little bit of difference. So I wouldn't say there's a magic number. When you speak about those other factors outside of age that influence egg quality, for example, I do talk a lot to my patients about lifestyle factors. So we're thinking things like smoking and drinking and recreational drugs, exposures to environmental things like plastics, BPA being one of the chemicals people talk about. So we believe these can also impact quality of the eggs, but age is going to trump everything. It is the biggest factor for women.
It's so good to know that. Thank you so much for that. So we know that reproductive health education, it varies widely. This is the fourth continent that I've led a school on, and every continent in country has a very different approach to this. What changes would you personally advocate for in how we teach young people about fertility and reproductive health?
I love this question because this is really my mission, to change how and when we're educating. I will commonly hear every week in the office, when I'm reviewing results with a young woman, I will hear comments like, I wish I knew this sooner. Why doesn't anyone talk about this sooner? Why didn't anyone ever tell me this? Women, young people in their teens and early 20s are talked so much about how fertile they are, how easily they're going to conceive, how much they need to prevent against pregnancy. And that is true. No doubt, you are most fertile at that age. But what we're not doing is extending that conversation to say, yes, you are most fertile now, but this will change with age. And be aware that once you enter your 30s, your fertility is going to start to decline. Plant a seed with them, not to induce fear, but to induce knowledge and awareness. So that, let's say that young woman is now 30 and she's starting her medical residency or her law career, and she's single. She's on the dating scene. She doesn't see pregnancy on the horizon in the next 4 to 5 years. She has that knowledge from way back when she was, a late teen, that this matters now. And she goes to see her family doctor and she asks to see a fertility specialist, and she can explore her fertility. And if it's right for her, she can consider freezing her eggs. One of the biggest things I say anytime I speak is informed individuals are empowered individuals. I stand by that. And I think it is our job now to make young women informed individuals, to empower them for the future so they can make the right decisions for themselves. It doesn't mean everyone needs to pursue any fertility treatment or consider egg freezing. It means that they are aware of what their options are. They know how and when to seek information about their fertility. I think it is our job to educate them and then allow them to decide the right path for themselves.
Yeah, I mean, this information, when I was a teenager, I would never have known this. And as a young woman, I wouldn't have known. So I think in my age group, that this was not something that was talked about even a little bit. I do think it's different now, but I do think that there can be more said and done to make sure that young women are fully educated on what their options are and the science behind what you're talking about.
Absolutely. I do most of my education now in the office with the patient sitting across the table from me. And while I do see a lot of young women being proactive, I'm doing a lot of my education to women who are trying to get pregnant and having difficulty. It wouldn't necessarily be different, but it might be. I think it is important to start educating earlier.
So we know that 20% of students who are entering post-secondary education, fields of study in STEM, 20% are women. That's it. And after the first year, about 10% are dropping out. As a school principal, as an educator, as a mom of girls, I think about that. Why are almost half of those women dropping out? And I'm curious about what the support looked like for you. There's lots of theories about why it could be, but really curious about your journey and the support that you received.
So I did feel supported. I think I had a lot of support at home, and that support allowed me to feel confident in what I was doing and look for opportunities and connect with people. But when I think about it and think about what we can do, when you hear those numbers, it's shocking, and what we can do to change them for the better. I really think of that support as kind of two-pronged. I think there's support in terms of people and connections and mentorship. And I think there's support in terms of opportunities and experiences. And I think that as parents and educators and as somebody in the field and in STEM, I think we can do a lot to provide both of those avenues of support in a lot of different ways. But I think the key really is to, helping young women create a network for support, but also to be connected to people who can help guide them, and also to gather those experiences and opportunities to influence them, to inspire them, and to give them the skill set they need to succeed.
I would love to hear any advice that you have for people like me, leaders of educational institutions who have the privilege to support girls and students. What kind of advice you might have about what can we do at school to influence and inspire girls to see medicine as a real, authentic, feasible pathway for them?
I really like this question. I'm glad you're asking. As much as I said I feel quite supported in the previous question, one of the things I think could have really helped my path would be to have had earlier mentorship. I was very lucky a little bit later in my educational career to have some great mentorship. But I think if my younger self had that, when you're thinking about going into the sciences, when you're in the grind in the beginning of university, and you want to go on a pretty competitive path, whether it's engineering or medicine, to be able to have a mentor who maybe is just several years ahead of you, who's just recently gone through it, who gets it, who can share their experiences, who can share their mistakes, who can guide you, but also just be a voice of reason and like an ear to listen and support. I think that's what we can do for young women to really help them, guide them into STEM if they're interested, but keep them in STEM because they are interested. That's what I would have hoped for, and I think that's where we can make a change.
I think you're right. And we talk a lot at Branksome about mentorship. It's a passion of mine. It has been for my entire career because I've been the great benefactor of having good mentors, but also excellent sponsors. And sometimes I think whenever I get the chance, I'm like talking about this difference between mentorship and sponsorship because I feel so passionately about it. And I think everything you've said, I agree with. We want good mentors for our girls. They have clear pathways. They can see themselves in these industries. But then I think about, even further to that, sponsorship, which is, really people that are willing to put down their political capital, their social capital to speak your name in rooms that you're not in. I talked about this in my podcast with Laura-Ann Munzer as well, and just how important that is, especially for girls. It's a real gap that I see. I see, boys getting that more than girls, quite frankly. And it's something that we're really trying to promote at Branksome and develop within our community as well. Did you have anyone that did that for you, that really sponsored you or pulled you up?
I would say early in my career, I definitely had, not searching it out, just sort of had a really great mentor, but didn't have that same sponsorship. And I could say that is absolutely what we need now.
How would that have made a difference for you?
I think it helps to build confidence, and I think it helps to build opportunities.
Opportunities, exactly. Yeah, it's about getting that first opportunity, right? And that can be so difficult for women, particularly in STEM fields.
I have a lot of friends now with girls that are older than mine who are thinking about, they're in high school or early in university, thinking about science, thinking about medicine. If anyone ever knocks at my door, I will bend over backwards to meet that young woman because, again, I want to be there and provide any form of support, even if it's just voice of encouragement, because I think to myself, how great would that have been? I had a very supportive family that were my cheerleaders, but to have someone who's in the field, who gets it, and sure, if I have the opportunity for helping someone with sponsorship, I'm going to do it because I do think that builds confidence, that builds opportunities, and who knows where that takes somebody.
Yeah, absolutely. And, we talk a lot about that, and we say, of course, we don't expect women to sponsor everyone. I mean, you have to be really selective about who you offer that kind of support to, but at least make sure you're offering it. Make sure you're mentoring lots of young women so that okay, I've mentored these 3 young women. This particular person I really see as being able to flourish and thrive, and I'm going to make sure they get that opportunity. Your work, when I think about it as an outsider, I just think I'm in awe of you. I think it must be just filled with emotional highs when things go really well and you can help a family, and maybe emotional lows when things don't go well. And, you have families who realize their dream, and then you have others that face real heartbreak. How do you keep your cup full? Because we all know we can't pour from an empty cup. And I imagine some days that might be harder than others.
Yeah, you're right. The highs are high and the lows are low, and some of them stick with you in different ways. I think for me, it's taken a lot of time in practice. I have a hard time turning it off and don't really want to. We talked about this before we started to record. I don't want to totally turn it off. I care for my patients immensely and think about them all the time when I'm not at work. But I do find it's important sometimes to try and shut it off. I've really learned to find two ways to recharge my battery. For me, spending time with my family, particularly my daughter, has really helped. I get a lot of joy and happiness, and it does allow me to really focus on her and just fill my cup. And the other thing I've as I age, have really learned is I also really need time on my own. I've really learned the value of spending time with yourself, whether it's going for a walk or reading a book or just watching Netflix on my own in bed. I've really realized that this can recharge my battery. I think for me, it allows me to just let my mind go elsewhere. And you need that mental break sometimes.
Oh, I hear that loud and clear. It's something I'm still working on, but I feel guilty. I'm going for a walk by myself. I think, oh, I should have the dog with me or my husband with me or my girls with me. And we just need sometimes that space to recover from the day. Yeah. Those are wise. Those are really wise words. You are in a field of medicine that is so female focused and really helping women become mothers. How has becoming a mother yourself changed your practice or changed perhaps how you are in your work?
I think it's changed me completely. And for the better. I think I was a great doctor before. I cared about my patients immensely. I pay a lot of attention to detail. I really want success for them. But I think becoming a mom was the best thing that ever happened to me. And I want that joy and happiness for every single one of my patients that wants it. So I think it kind of lit a fire in me more, makes you more empathetic, but also just gives you a different drive. I truly, if you sit across the table from me in my office and I hear your story, I want success for you. We will figure things out, do all the tests we need to do, try and optimize treatment, because I really do want that joy and happiness for every single one of my patients.
That's really beautiful. I wonder, you are becoming a mother, you're pregnant, and you're going into your job every day, working with women that really want that. Was that hard?
It was hard. You spent the first several months trying to cover it up, but we all know at some point that's not really possible. And for sure, you can see that it's hard for patients to sit across the table from you and see that. Anytime a patient comes into my office and is upset because of who they sat next to in the waiting room, maybe someone was pregnant and waiting for their ultrasound, or sitting across from me, the one thing I've said to some patients who share their sadness or frustration is just remember, in a place like this, you, meaning the clinic, you have no idea what that person's journey and story was. And yes, it's difficult and it's okay to feel sad and frustrated, angry, whatever that feeling is. But just know everyone has their own story and, think positively, focus on your own journey and your own story. So yeah, it was hard, but you just have to move forward.
Have to move forward. That's really, really good advice. So you are on social media sharing good information with people. And so I'm so curious, how do you see social media influencing public perceptions of fertility and reproductive health?
I think social media has some definite pros and cons when it comes to fertility care and medical care in general. I am out there, or the reason I went out there on Instagram was because as I scanned Instagram, I saw so many people putting out information that was not accurate, not credible. I saw many people calling themselves fertility experts with no credentials whatsoever. So my goal really was to get credible, reliable health information out there from a fertility doctor. So my big advice to my patients is make sure that you are getting information from someone credible and that you know what their credentials are. The flip side of it, I will say, so there are negatives in that there's a lot of misinformation out there. The flip side is that there's also a lot of conversation and awareness that has happened because people are sharing their experiences. So there is a positive aspect to it whereby we are getting more fertility conversations and fertility awareness from people that are sharing their own journeys. But the one thing I always say to my patients is so-and-so's diagnosis or treatment options aren't yours. Everyone's story is very, very unique. So take what you hear with a grain of salt. It's great if you want to develop a support system for people who are having similar experiences, but they aren't your exact experience, and you can't take medical information from that.
I'm so glad that you are on social media, because it's not in my algorithm to be looking at fertility things. My algorithm is more like mid-40s women trying to stay fit and gain muscle. And it's interesting because in my algorithm, there's so much false information around that topic. Lots of people who are fitness specialists, experts, who definitely are not. And even as an adult who's educated, I have to keep reminding myself, no, fact check that. That might not be true. So I'm just imagining if your algorithm is filled with fertility information, you would be the best face to see come up on that scroll. And I bet there's lots of misinformation out there that you're working to correct.
Every day.
Yeah, we're glad you're doing it. Well, I think now it's time for our rapid fire questions.
Okay, ready.
Okay, are you ready? So I love this because before you were like, rapid fire, does that mean just like one word? And I was like, it was supposed to mean that, but no one does that. And when I'm on other people's podcasts, I thought this was unique. It's not, everybody does it. And like rapid fire, I'm like, can't do it. I have to give at least a sentence. So it's okay if it's more than a sentence. What is one song that you play on repeat? And we ask because we're developing a Branksome Hall Spotify playlist, so your song can be on it.
So our current song, I say ours because it's, me and my daughters, probably most commonly right now is Coldplay.
Which one?
The Scientist.
Oh, how fitting.
I know. My husband created a playlist called 80 Songs for her. And it's 80 songs from all genres, all decades of his life that he's liked.
Oh, that's so awesome.
And he wants to share with her. So she's exposed to so much different type of music.
That's great.
And so currently we often listen to that on our drive to school.
Oh, I love that. That's a really good idea. I'm going to steal it. Although my girls won't do it. They'll be like, no, your music sucks. What's a guilty pleasure you have that you would never give up?
I'd say watching Netflix and binging till the wee hours of the morning when really I should be sleeping. So do as I say, not as I do.
It's like, what do they call it? Bedtime revenge or something where you should go to bed, but you just didn't have any time to yourself. I hear you. If you could switch lives with any person for one day, who would it be?
So to be honest, I don't think I would switch lives with anyone. I really do love the life that I am living and I've created. But if I had to pick one person, I think it would be my mom at a younger age. So I could see, what life was like for her in India and like what her experiences were like that made her the woman I know and that I learned from. I think that would be cool.
Oh, that is such a cool answer. I was asked this question on a podcast and I said the same thing. I'm like, no one, I have the best job in the world. Like I wouldn't want to change I love my life. But no, I think I would do that too. Choose one of my parents and go back to when they were younger. Fascinating. Best piece of advice that you've ever received?
So we touched on this a little bit, but so not a piece of advice per se, but one of the most important things I learned was from one of my own mentors. Her name's Dr. Heather Shapiro. She's actually a fertility doctor in this city. And she truly taught me the value and importance of mentoring the next generation of women.
I love that.
So if it's someone interested in STEM or in their residency or fellowship or early in practice, I have some young colleagues, I am more than happy to share my time with them, my expertise, my mistakes, my experiences, because I think if we don't do that, we're not helping the next generation grow and be better.
I think it's our duty.
Agreed.
Absolutely. And the last question, how would you like to be remembered?
That's easy. As a good doctor and a good mom.
I love it.
And that balance is super hard.
It is hard, but I think you're doing a great job.
Thank you.
Thank you for taking your time to be here today. It was an honor to have you, and I'm so excited that you were our first parent community guest. Thank you for the time being here. To all of our listeners and our viewers, thank you for spending some time with us. We look forward to seeing you on episode 6. Please like us, follow us. You can hear us on Spotify. You can watch us on YouTube. Anywhere you get podcasts, you can hear or watch. So we're so grateful to have you, and we'll see you next time. Bye for now.